decriminalizing all drugs. In 2009, a report from the Cato Institute came out calling this experiment a success. What are your thoughts on decriminalization of substances to help lower addiction and drug abuse rates?
Well, first of all, there's something you can always learn from another country's testing and adopting a different policy. And Portugal had a problem with drug abuse and also the allocation of their own enforcement resources. So they said, instead of putting our enforcement resources against the simple users, we're going to put it against a trafficking organization, and we're going to put it in rehab programs. And the result of that has been that their arrests for trafficking organizations went up. The number of people in rehab went up, which is a good thing. And I think you can probably debate about the impact on usage. The Cato Institute that did this study, you've got to understand the Cato Institute. What a great organization, but they're libertarians. One of their big points of advocacy is, let's legalize drugs. So, that's a little bit of a point of view that they bring to the table. But if you take a little bit more independent review, the European Monitoring Group, or the European Union, looked at Portugal, and whenever they decriminalized in 2001, drug use was at 7.8%. It went up to 12% after their decriminalization effort in 2007. That's a significant increase in drug use. Whenever you're looking at marijuana, it went from 7.6% to 11% in Portugal. And so I don't criticize another nation. They've got their unique problems. But the point I think you can learn is that marijuana use went up in Portugal when they decriminalized, because it was a simple signal that the leaders said to their youth of the nation, and maybe to the older citizens as well, that marijuana use is okay. There's not going to be any consequences. We're not even going to consider it illegal, so it's okay. Drug usage goes up. And I don't think that's the right direction for America.
Well, Asa's right. Cato Institute, good studies. They are a libertarian organization. So therefore, look at the article by Alex Stevens and Caitlin Hughes in the British Journal of Criminology at the end of 2010. Two academics looking intensively at the Portugal story. And what they found was that Portugal was a resounding success. That drug use levels did not change all that much. Some a little up here, some a little down there. And then when you compare the use levels in Portugal to other countries in Southern Europe, they basically track some of those levels as well among overall use. But you know what went down? The problems with addiction went down. Drug-related arrests and crime went down. New HIV and new Hep C cases went down. Overdose fatalities went down. And there was all the things that really matter. The harms of drug use were what went down. And you know what that Portugal thing is? It's essentially like almost like a drug court outside the criminal justice system. If you get arrested and you're in possession of some drug, any drug, in a small, non-large amount, you get sent to meet with a commission of health experts. And they talk to you about what's going on, and do you have a problem, and are you addicted, or is this not really such a problem, then you really shouldn't do it, get out of here. And for them, they focus on the most serious cases, which is when drug addiction and mental illness intersect, where nobody's got a good answer in that area. But they treat it as a health issue. And you know what else? They don't drug test. They don't drug test. They rely on counseling. They deal with drug use for the entire population the way America deals with drug use among the upper middle class. The upper middle class in America, by and large, is not going to jail or prison because they deal with their drug problems and drug use behind closed doors where typically the police are not present. And they can pay for the psychologists and therapists and dry out programs, what have you. It's the poor people who are getting screwed, who are being told, go to jail first. And the Portuguese says, same model applies to everybody.
Ethan quoted the British Journal of Criminology, and I would cite that study as well in regards to Portugal. They reported in Portugal a 63% increase in the number of drug users in treatment, and a 499% increase in the amount of drugs seized in Portugal. Now, you can interpret that different ways. I think it means that they are putting their enforcement resources still to stop drugs coming into that country. And so they've got a divided system in Portugal. They're telling the users, we're not going to do anything to you if we find drugs on you. But if anybody brings those drugs into the country, we're going to arrest and we're going to prosecute you. So what signal does that send? You know, I think there's a fairly good debate. In fact, we debated this while I was at the DEA in Detroit. You've got a poor, economically depressed area where you got your crack houses. Well, you've got your whites from the suburban area driving across town to the crack houses and buying their drugs and going back. Now, is it right for the DEA just to prosecute the crack dealers? Or should they go after that white guy coming from the suburbs who's a user? Now, under the arguments here, you leave under Portugal argument, you leave the white guy in the suburban area alone and you go after the crack house. Well, I'm not sure that's good policy. I think a better policy is put your resources on rehab, make sure you work in your drug courts, you have your treatment programs available, you make sure your education, but send the signal that it's illegal to transport drugs, to deal in drugs, and it's illegal to buy drugs. Otherwise, you got a conflict.
Asa, the question comes down to how many hundreds of billions of dollars and how many millions of wasted lives do you want to spend in order to send a certain message? I mean, the Portuguese and people like them and governments like them are sending a message that we're focused on the bottom line. We want to reduce death and disease and crime. Drug use may go up or down, but we want to reduce death, disease, and crime, and we want to save the taxpayers' money. That's what they want to do. They're not legalizing all drugs, but they're not doing a war on drugs either. If they're seizing a lot of drugs at the border, it's because they're part of the European Union. Most of the drugs coming to Portugal are going elsewhere in Europe, and they have obligations to the rest of their neighbors. It has nothing to do with the message that you're talking about. But when you talk about message, I mean, come on already. 750,000 people busted for pot to send a message. Millions of young Americans given criminal records to send a message. $40, $50 billion a year being spent on the war on drugs to send a message. People's lives being destroyed to send a message. Stop with the message already, or do an alternative message. How about the message being, we don't want you getting hurt by drugs or by the government. That's our bottom line.